What is neurodiversity-affirming therapy? Hi, I'm Shannon, a neurodiversity-affirming therapist in training. I'll be receiving my master's degree in December, and then I will be taking the licensure examination later next year. And as of right now, I am still in my internship as a therapist in training. So what is neurodiversity-affirming therapy? Core principles of neurodiversity-affirming therapy are as follows. Respect for differences. Neurodivergence is a part of the individual's identity and should be viewed as such. It's not a flaw by any means. While much of society views it as a flaw, and yes, because of the way society is, it can be a disability. That doesn't mean it's a flaw. Collaboration. We work with clients, honoring their lived experiences and self-knowledge. We validate them. We take a strengths-based approach by focusing on unique skills, talents, interests, not just challenges. We can empower our clients. Environment-focused. This principle acknowledges that many neurodivergents experience barriers, specifically in their environment. Primarily, those barriers are sensory issues. Bright lights, overhead lights don't work for many neurodivergents. Excess sound, making sure the neurodivergent individual has a quiet place. The ability to use sunglasses and headphones to reduce sensory overstimulation in practice is a necessity. Recognizing that there is a stigma around neurodivergence, and many of us as neurodivergents, we experience that daily. There's also a lack of support for neurodivergent individuals, specifically those diagnosed in adulthood. Individuals diagnosed in childhood have far more supports during childhood than they do in adulthood. A lot of times they will carry over, especially if they also have a learning disability or an intellectual disability, but they are not one and the same. Autism and intellectual disabilities are not the same thing, which means there's no such thing as profound autism. It would be autism and a learning disability, or autism and an intellectual disability. Self-advocacy. This principle encourages clients to define their boundaries, their own needs, and their accommodations. What does neurodiversity-affirming therapy look like in practice? It has a lot to do with the language we use. We use identity-first language rather than person-first. While the majority of the professional world and individuals who may be close to a neurodivergent individual but not within their core system, such as their parents and their siblings, individuals on the outside of that core system, such as friends, other family members, professionals, teachers, counselors, doctors, whatever, will generally prefer to use person-first language due to historically families fighting for that need to be seen as more than their disability. However, for neurodivergent individuals, this is much different. As an autistic person myself, and many other autistic and ADHD individuals, we prefer identity-first language. Rather than calling us person with autism or has autism, we prefer to use the term autistic. I am autistic. He is autistic. She is autistic. But that isn't to say that's the only language we use. It really relies on the client's, the patient's preference. There are some neurodivergents out there that still prefer the person-first language. And so it's up to us as clinicians to ask them what their preferred language is. Therapeutic goals. Part of neurodiversity-affirming therapy is to guide the neurodivergent individual away from masking, to accept their true self, to rely on fidgets, like fidget spinners or little stretchy worms or these little texture things, whatever the case may be. Many neurodivergents I work with, I keep bracelets on hand that I give them, and they will use it to snap against their wrists. And this allows for a type of pain stem that isn't really harmful, because these silicone bracelets only stretch so far and they only provide a tiny bit of pain, and it's just a way of shocking the system to ground the individual. It's important for us as neurodiversity affirming therapists not to rely on typical behaviors or force typical behaviors. If an individual is stimming, flapping their hands or covering their ears or rocking back and forth, or they need to stand up and pace, move around the office, whatever, we should let them. This is their time to be who they are, and we need to empower them to be who they are. Now, when I say to use stimming, that's not to say that we can't encourage better stimming. There are stims that can be very harmful to the individual, such as hitting their head against a hard object, hitting their heads with their hands, biting or picking at their lips. I know I do this a lot. Whenever my lips are chapped, I will pick at my lips. Skin picking, hair pulling, eyelash plucking, different things like that. I'm guilty of those. I have done those things all my life as a neurodivergent individual, and I never quite understood why until I understood my neurodivergence. So it's important for us to not only encourage stimming, but to encourage useful, productive stimming, not harmful stimming. Redirect neurodivergence away from harmful stims. Adapted methods. We modify traditional therapies like CBT and ACT to fit into a neurodivergent process style. I use a lot of workbooks, neurodivergent friendly workbooks for DBT, dialectical behavior therapy, or CBT, cognitive behavioral therapy. Why reinvent the wheel? If somebody already has these resources, we should use them. There are tons of workbooks out there. Currently on my shelf, I have the Autistic Burnout Workbook. I have a PDF of it on my computer at the office. I use the Neurodiversity-Friendly Workbook for DBT skills. And I use a number of other therapeutic practices and workbooks to help me in altering the traditional styles of therapy to a more neurodivergent friendly method. It's also important to use visual supports, slower pacing, or special interests as the therapeutic tools. Mr. Rogers was amazing at doing this. If you go back and watch any episode of Mr. Rogers' Neighborhood, he essentially developed neurodiversity affirming therapy before it was even really a thing. I highly promote Mr. Rogers' Neighborhood in my practice and in school when I speak with other therapists in training, and when I turn in assignments. I will highly promote Mr. Rogers' Neighborhood because he was the originator of neurodiversity affirming therapy without giving it that name. He studied under Erik Erikson and used a lot of Erik Erikson's developmental theories along with Dr. Spock and others. And he created this approach where if you look back at any interview he gave, any episode of Mr. Rogers' Neighborhood, whatever, he slowed down his speech to really process, not only help others process what he was saying, but to also process what others were saying to him, to make sure he fully understood and that others fully understood him. And he would say things in the most simple of terms, the most specific ways. He created routines in his episodes where he would start and end each episode the same way, and it would have the same experience throughout the episode, a ritual. And that's important to bring into our therapeutic practices as neurodiversity affirming therapists. I highly encourage anybody considering using neurodiversity affirming therapy in their practice, watch episodes of Mr. Rogers' Neighborhood. He is the GOAT when it comes to neurodiversity affirming therapy. Use support systems. Work with the families, schools, workplaces, and communities to increase understanding and accessibility. Something I also like to bring into my therapeutic practice is I will combine different forms of therapy with clients. And this is with adult neurodivergent clients. I will utilize play therapy, music therapy, art therapy, along with talk therapy. I will combine them all. I rely heavily on the feelings wheel or emotions puppets. There is no one right way when it comes to neurodiversity affirming therapy. We have to combine different methods. Use play, use art, use music. I have found the majority of my clients are highly receptive to music especially, but also art and play therapy. That's why I decided to go the child therapy route in school rather than the adult track, because there are a lot of methods I can bring from the child track and utilize with adult neurodivergence. Taking a trauma-informed approach in neurodiversity affirming therapy is also extremely important. Ask if it's okay to proceed with certain lines of questioning. Validate the individual's feelings. Don't force them to do something they're not ready to do. A lot of times, neurodivergent individuals will also have OCD, obsessive compulsive disorder. Exposure therapy is often considered the gold standard when it comes to individuals with OCD. However, for a neurodivergent individual, exposure therapy can be extremely traumatic. And that's why I highly encourage any neurodivergent individual or any therapist working with a neurodivergent individual who also experiences OCD symptoms to try to steer clear as much as possible from exposure therapy. If you're going to introduce exposure therapy into the session, do it very, very gradually, much slower than you would with an individual who is just OCD. I hope this helps in your understanding of neurodiversity affirming therapy.